Hello, this is Dr. Gay from First Look MRI, and this is a 33-year-old female who had swelling of her hand. She was sent by her doctor to an orthopedic surgeon who palpated a mass, and then they ordered an MRI scan here to see if the mass was a cyst or a solid lesion that would enhance. And we have an x-ray here that just looks normal. And we did an MRI here without contrast on this view. It's called a stir sequence, where anything abnormal shows up as bright. And right here in the palm, where the doctor was feeling a tumor, sure enough, there's a tumor right here. It has well-defined margins, and within the lesion, you see these little septae, these little separations. So we can see that this is a really hyper-intense mass, but it's not a cyst. It has this internal structure, so it's a solid lesion. And the next question is, would this thing enhance, or what are their enhancement patterns? Is it enhancing around the periphery, or just patchy enhancement, or uniform enhancement, or no enhancement? So this is the post-contrast, and this is the pre-contrast image. And you can see that before contrast administration on this T1 view with fat suppression, the muscles are gray or intermediate, and the tumor is intermediate, so it looks very, very similar to the muscles. Kind of hard to see. You can see it splaying the flexor tendons here, the second and third flexor tendons. And with contrast, we see a very prominent, uniform, intense enhancement all the way throughout. This has lobulated margins, and it looks non-aggressive. Now within, you notice these little speckled areas of low or intermediate signal within it, and this is just a classic example of a neural tumor, a benign neural tumor, when they look this simple and clean. And when they have this nodularity and intense enhancement, we usually think that this is a schwannoma, a type of peripheral neural tumor, and it looks just like this. So just a nice example of an intensely enhancing soft tissue tumor that is lobulated with these little areas of ill-defined nodularity within. Classic for a schwannoma. This is probably a branch of the median nerve. And just a few more images here. You can see the side view. This is a sagittal view. You can see the tumor within the palm here, well defined. This is following contrast. You can see that intense enhancement and the very well defined margins. This is a coronal image of the same thing. We can see the lobulation. It's a little finger-like projection here distally. So a nice example of a schwannoma within the palm.